Genetic markers and variations can significantly influence an individual's response to chemotherapy and their susceptibility to treatment-related toxicity. Understanding these genetic factors is essential for personalized cancer treatment. Here are some key genetic markers and variations that impact chemotherapy response and toxicity. 1. Drug metabolizing enzymes. Cytochrome P450, CYP, enzymes play a vital role in the metabolism of many chemotherapy drugs. Genetic variations in genes encoding these enzymes, such as CYP2D6, CYP2C9, and CYP3A4 can affect the rate at which drugs are metabolized. Variations in these genes may result in altered drug levels, affecting both drug efficacy and toxicity. 2. Drug transporters, ATP binding cassette, ABC transporters such as ABCB1, P-glycoprotein, and ABCC2, MRP2, are involved in the transport of chemotherapy drugs across cell membranes. Genetic variations in these transporter genes can impact drug uptake and efflux, influencing drug levels within cells and altering treatment response and toxicity. 3. DNA repair genes. Genetic variations in DNA repair genes can affect an individual's ability to repair chemotherapy-induced DNA damage. For example, variations in BRCA1 and BRCA2 genes have been associated with increased sensitivity to DNA-damaging agents like platinum-based drugs. Conversely, alterations in other DNA repair genes, such as XRCC1 and ERCC1, may contribute to resistance to certain chemotherapy drugs. 4. Drug target genes. Genetic variations in genes encoding drug targets can influence drug response. For instance, variations in the epidermal growth factor receptor EGFR gene have been associated with a response to EGFR inhibitors like gefitinib or erlotinib in lung cancer. Similarly, variations in the HER2 gene impact the response to HER2 targeted therapies like trastuzumab in breast cancer. For example, 1. TP53 tumor suppressor gene. TP53 is a well-known tumor suppressor gene involved in regulating cell cycle progression and DNA repair. Mutations in TP53 are frequently observed in various cancers and can affect treatment outcomes. Patients with TP53 mutations may exhibit altered responses to chemotherapy and may require alternative treatment strategies. 1. Glutathione S-transferase GST genes. Glutathione S-transferase enzymes are involved in detoxifying reactive drug metabolites. Variations in GST genes, such as GSTM1 and GSTT1, have been associated with differences in drug metabolism and susceptibility to chemotherapy-induced toxicity. Some genetic variations may result in reduced detoxification capacity, leading to increased drug toxicity. It is important to note that the influence of these genetic markers and variations on chemotherapy response and toxicity can vary depending on the specific chemotherapy drugs used and the type of cancer. Therefore, comprehensive genetic testing and interpretation, along with clinical considerations, are crucial for guiding treatment decisions and optimizing personalized chemotherapy regimens.